Hey everybody, it's Robbie Bessner, and we're back with another amazing episode in our Lyme series. So you all know me as the co-founder and device developer for Therasage, and this Lyme series is being sponsored by Therasage. And today we have just a super dear friend, Dr. Michelle Perro here. To be with us. It's going to be an amazing interview. I was reading her bio earlier, and it's just pages of accolades of things she's done, things she's sponsored. We actually met serendipitously because we were both part of a symposium in Beijing. And we just started talking on a little round table. And after a few moments, like besides the connection that we felt, we found that we had a common friend, Jeffrey Smith, who's a documentarist, and apparently Michelle was co-sponsoring with Jeffrey, and correct me if I'm wrong, Dr. Perro, but a GMO series that he was bringing to light. And so, Dr. Perro, tell us a little bit about your background, and then let's just dive right back in and unpack the important things you have to say about Lyme disease.
Thank you, Robbie. I'm here because at this point in my long career and life, I've decided to align myself with people whose values resonate with my own. That's a choice as an elderly woman. That's why I'm here, because I believe in what you're doing. I just want to say that for your listeners. That's number one. Number two, let me go to the end, and then I'm going to start a little bit at the beginning, is that, again, I'm aligned with Jeffrey Smith, and just like literally hot off the press, your listeners are hearing it first, joined on with him with his newest project called Protect Nature Now. People should check it out. I believe in it, and I'll give you the link. So briefly, because we'll be here for a few years, my journey begins, basically as a Western trained physician, Mount Sinai, NYU, Bellevue, New York Medical College, right? I was deep, but not convinced. And what I mean by that is things didn't feel right. I've always believed in children. Children are my passion. They're my calling. It's not a career, it's my calling. And my biggest overarch is injustice, medical injustice. And for those who have not been served. And how does that relate to today's conversation, Robbie, is that those who have not been served are children who've experienced chronic infection. And they have been neglected, mistreated, maltreated, ignored, and called crazy. And we need to dispel that myth before we begin. So let's just lay that out there, that's one of my and that's another reason, because Jeffrey and I talk about gene editing of microbes. Oh yeah, it's all linked. So my journey, I came to California from New York, a little Lower East Side girl, to crunchy Fairfax, California. And lo and behold, world gets shaken up when I had a kid. And my kid had health challenges, and I stumbled into homeopathy. I'm a proud homeopath and user. Things that I often don't share with mainstream medicine because of the eye rolling. I got so tired of eye rolling, Robbie, that I just couldn't even say I was a homeopath anymore. But nobody died from an eye roll, okay? My skin's a little bit thicker after 4 decades in the medical establishment, I should say. And my son got better through homeopathy. I have other kids well. But my own journey, we began, I had a patient, and she had Bartonella striae, okay? And you say, whoa, where she's jumping into the Lyme conversation. Bartonella is a microbe, it's a bacteria, it's carried by ticks, it's carried by cats, and it's often not diagnosed. And this was many, many years ago, and I didn't know what the heck that was. I'm talking decades ago. And later I learned that was Bartonella. And I thought about all the kids decades ago that I missed because I wasn't educated. My son got diagnosed with Lyme when he was 5 in Martha's Vineyard off of the Northeast. It's 80% of Martha's Vineyard denizens, I think, are positive for Lyme, is the last stat I saw. And through healing, and then I treated him when he was just a little guy. He's a big guy now. And I thought, oh, I'm done. Wow, I'm amazing. Oh, stop the press. Not so amazing. Little did I know about persisters and co-infections,
Right.
terrain, psychic aspects of healing I didn't know. My
Right.
son's doing great. It's been a rough journey. He's doing great. He's married. I love my daughter-in-law. So that's how I got here. Lots of bumps, bruises, missteps. But the one thing I share with your listeners today is that you need to work with someone. This is complex, it's chronic. And before we get into the nuts and bolts, this is a hard journey to go alone. As a practitioner who's done a lot of self education, super difficult with one of my own. So I've lived this journey with very close family members and my patients whose little sick souls I carry around my little aura, my energy field, their little sick souls with me, trying to help those families as well. And so that's the palette of paint that I want to lay out before you and I converse about what I think is probably one of the most important things affecting children.
It's, there's so many chords that you're striking in what you're saying to me. The family dynamic is one of them. The fact that you've chosen to focus on pediatrics and children is also completely interesting to me. Children have challenges articulating what's going on with them to start with. We're big people looking at little people, and little people, it's kind of scary and they don't feel well. And then you overlay that with the oftentimes Lyme and the co-infections. The symptoms are diverse. They're very individual from person to person. And so it's not a very easy one to diagnose or to figure out. And then just recently, in the last 5 years, there's been some great advancements. But if you dial back 20 years ago, 25 years ago, when we got started on our journey with our daughter, there weren't a lot of Lyme literate doctors around. They were still poking around trying to figure out what to do. And most of the protocols were, the allopathic, very intensive with using antibiotics and so forth, and having homeopathy and having integrated approaches to figuring it out, getting people stable and getting on track to good health is a wonderful, through your own journey, to bring to all of us. And so thank you for your contribution in many ways. And so give us some tips. Let us know, let's unpack this a little bit. Yeah. So tell us, we've got Lyme patients that are, challenged and in bed because they're symptomatic and they can't seem to get out of bed. They have no hope. They're a little bit sort of depressed because they may be exhausted both physically and financially. And, everyone's trying to help and trying to figure it out, but yet they're not getting better. And then we've got the other scope where we've got functioning Lyme patients that just want to stay as healthy as they can be and stay ahead of the curve. And so there's a full range there. Give us some idea of some of your ideas of sort of where to start and what you would recommend.
Sure. I've learned a lot about Lyme, and I like taking, one of my favorite things to do is take a complex subject, which is Lyme. Let's just call it Lyme, which means Lyme and co-infections. We'll call it Lyme for simplicity, and simplifying it. If I can't do that for listeners, patients, clients, friends, then I don't understand the subject. Okay, so I believe this can be simplified because parents, for example, are not practitioners. Okay, so you can't, learn what we all know. And Robbie, in essence, you become a practitioner. You get your honorary degree. So, couple of things, couple of key points. Number one, listen to your child.
Right.
So, whether the child is 6 months old, there is congenital Lyme. You can acquire it through the passage to the birth canal. I believe transplacentally as well, because the placenta is not a barrier. Okay, things cross in the placenta. Microbes are small, and remember, if you get a tick bite or you have Lyme, you also have viruses as part of the infection package. So these viruses are super tiny, easily cross the placenta. So whether it's a 6-month-old, a 2-year-old, or a teen, if your child's not well, you should listen to them. How do you know your child's unwell? Depends on their age. Is your baby crying all the time? Arching, not feeding well, not thriving? Is your 2-year-old grabbing her tummy all the time, making hard poops, having just endless blowouts of emotion? Is your middle school kid doing great and then falls off, starts having elements of emotional distress, psychic disorders, bipolar all of a sudden, and you live near the outdoors, or even not? Ticks are ubiquitous, and they're not the only carriers of Lyme.
Right, exactly.
And then to your young adult, all of a sudden they don't want to get up in the morning. They have chronic abdominal pain, they're refluxing, they have chronic headaches and emotional symptoms. Please, the most important thing I can say about that is do not negate the emotional health of your child. The head is not cut off at the neck. The head talks to the gut. There's a pathway called the autonomic nervous system, the vagus nerve, wandering nerve that goes from your gut to your head. The microbes tell your body what to make, what to not make, go right up into your head. These organisms are diffused throughout your body. There's a conversation going on through this gut-brain axis. So mental health changes can be a presenting sign of Lyme disease. That should be in every practitioner's differential diagnosis for your kid with new onset bipolar disease or whatever. Think about infection. Okay, so 1, listen to your child. So 2, you see your practitioner and they're blowing you off, writing it off, poo-pooing the child's symptoms. Leave.
Yeah, find somebody else.
Find someone else. And these are called Lyme literate. Now, you may not think about their Lyme literate practitioners, and maybe you don't even want to start there. Maybe it's not Lyme. However, maybe you want to go to a more holistic practitioner. And holistic practitioners, this can be a bit challenging. Email your friends and colleagues and say, hey, my kid's going through this. Anybody have any tips? Someone out there is going to know someone. And those can look like chiropractors, acupuncturists, holistic nutritionists. They may look in naturopathic doctors, people like me, MDs with integrative training, functional medicine MDs. Look for somebody with a holistic mindset. Even if they cannot treat the Lyme, they can at least help you sort it out. And that is a key component. So now you're listening to your child, you're finding an appropriate practitioner to work with, you're getting rid of all the people who pooing you, misguiding you, telling you, yeah, I did some labs, your kid is normal, there's nothing wrong with them. And then you're seeking out someone to work with. This is a hard journey to go alone, folks. I don't recommend it. It's a bit too complicated. There are other things you can do on your own, but not this one. And so that's how we start. And 3 is diagnostics are great. I like lab tests, Robbie. I do like testing. I like to see what we're dealing with. And Western labs are not very good. Traditional mainstream medicine labs are not so good in this arena. Some are okay, most are not. Vitamin D levels, checking zinc and magnesium levels, looking at B12, looking at potential stool testing. Yeah, those are pretty good, but you really need labs that are outside, and those are often not covered by insurance. So then you say, well, gee, I have no money to pay for a $400 Lyme test. And I say, you know what? It's a clinical diagnosis. If your teen has migratory joint pain, chronic headaches, brain fog, fatigue, intermittent rashes, visual changes, or any of those combination of stuff, and lots of gut stuff, all kinds of gut stuff, I'm going to treat them for Lyme and co-infections and get the labs that I can that your insurance will cover, because it's a clinical diagnosis. I don't need lab tests to know that this sounds like Lyme. So now we've got that piece. Okay, so for the listeners, we're listening, we're finding the right provider, we're doing diagnostics in the system or out, depending on your finances, and then we'll get into where do you go from there.
Let me jump in just for 1 sec.
Jump in.
You know, it occurred to me a few years ago about the internet and the information sources that we have there. And now people are COVID bound, so they've got plenty of time to jump in research. And it's sort of a double-edged sword, because you've got this internet as a resource that enables you to research things, but there's lots of bad information there too, you know? Now, when you're basically feeling okay, you sort of have all the time in the world, in a sense, to kind of look around, poke around, then ask around. But if you're feeling yucky, you're not thinking clearly. Many of the Lyme community, they've got cognitive challenges, you know? And so it's not clear to start with. And then they jump onto the internet and they're just swallowed up. It's just, and that's pretty much why Melody and I are putting together this program for the month of May, because we want to cut through all of that smoke and mirrors, all the what we call noise out there, to really get down to root causes, root challenges, and certain root solutions to all this. So that's why we so appreciate you. The chat rooms, the Lyme chat rooms in particular, are great communities to go to just talk about what you have. If you're a mother or a family member and you think that your child is going off the road a little bit, to just sort of say, well, could this be, you know? And then that is clues that could, because they're super sensitive, everybody, it really is a great sense of community. And we've been participating in them from inception, basically for the last 25 years. So I love that. And then I wanted to just say, I have a dear friend that's a practitioner, like yourself, integrated, holistic, and he has Lyme and his family has Lyme. And what he said to me was pretty interesting. He uses a homeopathy approach rather than doing a diagnostic like a blood test, because many times you can get false negatives, false positives, and all that, right? He actually uses a treatment, like a homeopathic treatment in low dosing. And then he starts dialing up the doses over 2 weeks. And if you have a Herx reaction, which is like a flu-like type reaction, then most likely you have an overgrowth or an imbalance of either your microbiome or Lyme or the co-infections. And then so when he puts that together with clinical representations as, you know, symptoms like you mentioned, he doesn't really need that confirmation from the blood test. He just jumps right in on the protocols. What do you think about that?
So that's wonderful to hear. And he's a practitioner, right? Or he's a dad. He's a practitioner.
No, he's a practitioner. He's actually an osteopath.
He's an osteopath. So yes, we practitioners can do stuff like that. For a parent to do that on their own, it's really hard. So for example, there is these homeopathic series kits. They're made by a company that I love and I teach for, in full disclosure, named Desiree Biologicals. And these series kits have different organisms and homeopathic dilutions that you can dial up and then dial down. It's a 2-month treatment. And I've had great success using these homeopathic treatments that do a lot, just like what you're saying your friend did. So one of the things I love to do with kids is, once I regain the terrain, and I'm going to be talking about that in my own website, is you have to get kids' guts healthy first. And I want to talk about that for a minute. I treat infections last, Robbie. It's not the first thing I do with a chronically ill patient. I go for the infection last, and there's a reason why I do that. I'll just say that. But then once you get everything working again, kind of as best you can, these series kits of homeopathy work great. And usually after about the first 10 days, kids can Herx as well. And that's what you referred to. And that's where you have a flare of the symptoms. And it could be an exacerbation. And then you're on the right track, and those tend to resolve. And there are ways to offset those symptoms very simply with Epsom salt baths and a little alkalinization, and some dietary changes, increasing hydration with higher pH fluids, simple things. And none of what I just told you, none of it costs more than $3. Some Epsom salt, some lemon water, you're good to go. So I like to do that also. Now, there are a lot of practitioners out there who have these special techniques. They're called EAV, and they're different techniques where they can test for, they can do muscle testing or kinesiology, and they don't need labs. And hats off to those folks, and they often don't need traditional blood work, because traditional blood work is often antibody based, and it can be a partially flawed system. So now we're getting into a little more of the nuancing of testing, for example. And so testing for me is an adjunct to my clinical prowess. And it's really helpful to have a clinician who's somewhat experienced in this conversation. Experience matters when treating Lyme. Now, we all have to start somewhere. And if you have a newbie practitioner, and they could be okay too. We all start something, Robbie.
Right.
We're born knowing this.
That's true.
And so, yes, if you find a practitioner who knows how to test, muscle test, and great, that there are other ways to test. There are other things to look for. I'm a big stool fan. I like looking at poop. That's my favorite thing to look at, and I get a lot of information. And remember, with kids, getting blood all the time is not so much fun, and especially when kids don't have great veins and all that. So anything I can get from saliva, poop, and urine, I'm all over it. Well, that maybe was a poor choice of words, but anyway. So yes, and just to your point, Robbie, where you get information from matters. The internet is like the inner mess, as far as I'm concerned. There's so much. You buy your way to the top. If you want to be listed at the top, you can pay Google enough to get your thing up there. And so it's so much misinformation. But the Lyme chat rooms, iLad stuff, Dr. Horowitz, get some books from really renowned people. I'm a big fan of Dr. Horowitz and his books about Lyme. He has 2 great books. Also Lyme.org, right? Lyme.org. It's a patient-driven website, etc. So there are other good sources to get information. Just be careful, and you're not just sold treatments. Everybody has a magic cure. There is no magic cure. I've been doing this for a little bit, and I have not found a magic cure. It takes a lot of different tools from the toolbox, but people do get better.
Interesting. For Julia, we redefined the word health, and maybe you can appreciate this. I said, Julia, Lyme could be ultimately like hepatitis or like malaria, where you always have a little bit in you. I believe that basically all of us have a little Epstein-Barr, a little pneumonia, a little cancer, a little this, a little that. It's really just the change in your internal climate that creates the opportunity for pathogens to take advantage, in a sense, right? Cause havoc. And so wouldn't it be better to look at this whole equation about health, more about how functional you are, like if you found your passion, what kind of contribution could you make to yourself, your community, your family, your religion, the things you love, and then how symptomatic you are. So if you're not symptomatic, if you got that managed, and you're somewhat making contribution, then the rest becomes sort of a label. And we all know that many diagnoses, particularly Lyme, goes so long misdiagnosed because it can mimic so many other kinds of, the symptoms can mimic so many other diseases that we'd rather take a step back and go, hey, whatever it is. That's just a label. Let's just focus on what central theme today is really listening and noticing what you notice, right? Mm-hmm. As a parent, as a family member, part of your community, either the patient themselves and or the family that's supporting them around them. So that's really a more modern approach that we took to defining health. And once we did that for my daughter, particularly Julia, there was a big shift emotionally and physically for her when it took the stress off, in a way. Does that make sense to you?
Robbie, it's spot on, because this is the kind of sobering news. I resonate with what you say because I don't believe you ever clear Lyme 100%. And I think the best I've seen is about 85%, 100% functioning. So there's new definitions of health, and I agree. You live with what you have. And it's not to say acceptance, but the battle has to stop. You can't battle it. The way you maintain it. And you're right, there are certain viruses. Everyone's heard of herpes virus. Once you get a herpes cold sore right here on your face, it lives with you forever. Not just the herpes virus. There are many organisms that you mentioned, Epstein-Barr, that's mono, that they stay within our bodies, can be forever. The same thing with Lyme. Lyme can go into different forms and it hides for years. It can go into remission. Tuberculosis. People know about TB. It can go into a dormant state for years. So how do you keep it at bay? And that's when I talk about maintain regain terrain. Now, what
Right.
does it mean? That means that this being, your body's innate ability to heal itself has to be restored, whether you're 2 or 42. How do you do that? Number one, you're right. I usually go to the food first, but let's talk about this mental piece first. First of all, is the belief in yourself, and you can do it with your 2-year-old or your 22-year-old, is that patients must believe that they can get better. And the way you do that is to believe you can get better and that you are in control. Lyme is dark. That organism produces a very dark mental state. It's not the person talking, it's the organism. They chat and they're dark. All the Lyme patients, and I don't say all frequently, would tell me how dark their thoughts get when their Lyme is flaring. And let's introduce this idea that yes, these organisms, and everyone has a predominant one. I rarely see anybody with just one, by the way, can ebb and flow, ebb and flow, ebb and flow, and they flare and they go into remission, they flare and go remission. Why? Depends on your stress level. Do not underestimate the role of stress. 2-year-olds get stress, high school kids get stress, academic pressure, COVID, oh, pick it. There's lots of stressors. So the belief that this body can heal itself, you have to manage stress. There are tools to teach your child how to manage their stress, and parents, manage your own. Anything you feel, you're generating energetically to your family. So mom, if you're stressed out, all your kids will pick it up. You have a new mom, she's stressed out, she's nursing that baby, and she's stressed, that baby's gonna be stressed out baby. So we manage parents. When you manage children with Lyme, you manage the whole family. When I say manage, you have to learn to manage it. It's that journey. So that's number one. But number two, the most important thing I do first is get the gut working.
Right.
Kids don't have their guts working. They have chronic tummy aches, bloated bellies. They can't poop, constipation, constipation, constipation. I ask kids every day, because I do urgent care as well, does your food come up in the back of your throat? Oh, yeah. And the moms are looking at them like, and I just say, moms, dads too. What? It's like they're refluxing, not normal. So we got to heal the gut. And otherwise, if you don't get that gut working, I say all bets are off. Don't even bother. So if your kid, if you're a young adult, if you as an adult are doing okay with your Lyme co-infections, get your gut working, heal the terrain, and there are ways we do that. And then we chase the infection. It is an infection. I treat them. I do use antibiotics, but there are different kinds of antibiotics. There are herbal, there are pharmaceutical. I use homeopathic. And then that's when we bring in all the tools in the trade. And so, yes, it's in my toolbox, but it's not the first thing I do. I want to get your body as healthy as I can get it, your immune system maximally function, your vitamin D, your vitamin C, all that stuff now we're hearing about COVID. Get your immune system as maximal as it can be. Lyme likes to suppress your immune function. Why? So you don't attack it. These organisms have been around for, oh my God, millions of years. And so we maximize immune function via a healthy terrain, via gut functioning, and then we go after the organisms. Which ones I go after? If you have 1, 2, 8 co-infections, I go after the one that's giving you the most symptoms first. And then I start to peel them off. And some people can handle treatment of many at once. I don't do that in children. Sometimes I've done it in adults, and you just start peeling them away. It's a very systematic approach, and you just start getting rid of the infections, and so many ways to do it. And so that's how you begin. But the beginning is to first recognize that the body has the innate ability to heal itself. You just have to restore that balance and get your kids into restoring balance as well. You can teach 3-year-olds, they love yoga, for example. There's kiddie yoga. So if you're home with your kids or COVID, do some kid yoga. You could, mom, dad, do it with your kids. Family fun project. So that's sort of my overall approach, Robbie, on how I kind of look. And remember, as you start to get better, a lot of other things peel away.
Right.
You know, even though, yes, we didn't get your Lyme, Robbie, but pooping, the kids start to poop, they're going to start to feel better. You heal the microbiota, oh, their brain works better. You start giving them various omega-3s, which I use a lot of, and you start healing their neurologic function, they start to feel better. They feel better, their outlook's better, the emotions up their immune function, depression decreases immune function, gut starts working better, flow, your chi, your vital force starts to move energy. You don't want to be stuck, and people do better.
Wow. You know, it's so important what you're saying because, you know, I almost think it's sort of the upside down approach oftentimes that Western medicine is driven towards these days. So you go to see a Lyme specialist and they want to show you that they are really, know what they're doing. So they're going to attack and just kill the Lyme. But, generally, if you're symptomatic when you go see the practitioner, your body is already toxic. If they were to go after the underlying source, let's just say it's Lyme and or the co-infections, and they're right in whatever their approach is, they're going to create an additional toxic event because they're killing Lyme. They're the biofilms, the microtoxins that come from the Lyme itself, the dead Lyme, these are all toxins. And so now we're creating a higher toxic event. And I hear this, and you probably hear it too, that if you take this antibiotic or you do this treatment, you're going to feel worse before you feel better. And so that's how you know it's working. And I kind of scratch my head because, in the stuff that we do, I like to take a foundational approach like yourself, where let's heal the gut, let's detox the body so that when we start to get proactive and maybe go after the source, the underlying source, your body is not going to be further compromised. You're actually going to be coming from a position of strength, almost like, I want to say going into battle. Isn't it great to have a plan and then have all your troops together and then effectuate the plan, but coming from a position of strength where your body, your foundational support systems, your gut, your detox pathways are opened up, you're well hydrated. And I just think that makes so much more sense to me. And as far as I'm concerned, if you detox beforehand, there's really no reason why you would ever have a Herx reaction, that flu-like reaction, which is really just your body saying to you that your cup runneth over with toxins internally. I think that's just brilliant. And for most people out there that are just tuning in, Dr. Michelle Perro is just, a thought leader in many ways and have done so many things. But I just love the content of today's discussions because it's so important for people to know. It may have taken a decade or more, especially if you're younger and you have a strong immune system, before you even become symptomatic. So be patient as a patient on the back end and understand it's going to take a while to come down or walk down that toxic mountain or that symptomatic mountain. Going up, it's hard to stumble up a mountain, Michelle. It's really easy if you go too fast to stumble down, come down the mountain. So slow and steady seems to be a little bit more of a healthier approach and a more foundational approach. And then, you know what? Everything else will sort of correct itself because your body's got an innate sense to bounce back and to heal. And I almost think that, I don't know if it's just about Lyme or just today's epigenetics and how our whole environment is affecting us, but I believe it's almost like our GPS systems, our guidance systems, our immune systems, they just sort of get turned off. And so we lose our way. But once you start to tune up, get the gut in balance, back into balance, and work on the foundational pieces, all of a sudden that guidance system turns on, and then it's almost like an orchestra tuning up. Your body wants to heal. It does have memory. Your cells and your muscles and your brain, it all has memory. And so just show it the pathway back home. And it's amazing how exponentially, as you start to heal, that your healing process really moves at a much faster pace, but it all comes from having that strong foundation. The last point just that you brought up just in passing is vitamin D, and it seems to be something that's just bouncing off of all of my walls in research. People call it a vitamin. It really acts more like a hormone. There's hundreds of physiological events that vitamin D stimulates. But you know, today's research, way early, like 4 in the morning for me, was about that we are all light beings. We get energized by the sunlight. When we're stuck in home and we're not getting fresh air and fresh sunlight, and it's wintertime and we're not getting sunlight, just like other animals in the animal kingdom, our bodies go into hibernation. Things start to slow down in many ways. Keeping that vitamin D level, I think it's supposed to be in the 80s, although the FDA says 45-ish is about right. Most of the Lyme patients that we coach and talk to, they start off in the teens, like 15, 12, something like that. So having a goal to get your vitamin D level up will support that terrain that you talk about, and then a lot of other things will come into alignment. So, wow, you've said so many things. I should have mentioned this in the beginning, but if you want to get a hold of Dr. Michelle Perro, there are a couple ways to do it. You can go get to her directly at her email, which is info.gmoscience@gmail.com, or you can go to her new website, Dr. Michelle Perro, spelled Perro.com. And she's also creating a membership sort of program. It's affordable to get in. If you can't afford it, there's situations you can work out with her where you can really be part of her collective and her community, where she was going to bring in a lot of other thought leaders. There'll be a lot of sharing, and certainly she'll have an open forum where, because you sign in and you join the group, there's a lot more freedoms of information that's being passed back and forth. So she's just the most valuable person on the planet, certainly on the West Coast, in information on many topics. So she's a force to be reckoned with. Dr. Perro, I know we've covered a bunch of topics today, and you've given us some amazing things. We're coming to a close, and I'm wondering if there's a few things that we've left off that you need to say, or if there's any closing comments that you want to make to us.
Yeah, Robbie, you did a great summary. And thank you for your kind words. And so the last thing I would leave with people is that there is a cost of convenience, and there is no shortcut in working with and treating Lyme. And treating Lyme with a family member will make the whole family healthier, by the way. And that there is an internal and external milieu. You have to heal the internal with clean water, clean food, but your external environment has to be clean too, whatever that looks like for you, and decrease that toxic load. Unfortunately, something has happened to children during COVID, which is Zoom learning. The EMFs from being on computer all day has created a sea of anxiety. EMFs are not good for children's brains, electromagnetic fields, and that is a whole conversation in itself. And I have reason to believe that for many people with Lyme, it makes it worse. So if you have a child or yourself with Lyme and you have felt an exacerbation during COVID, well, it could be stress induced, it could be your food, it could be your computer. So shut off the devices as much as you can. And as kids go back to school, if we can get them outside playing. So again, it's about balance. So we clean the internal, we clean up the external environment. And if you don't do that, you can still get better, but you may relapse. There's a more long-lasting health effect if you can decrease the toxic load. And we live in a very toxic world. So it takes effort. Lastly, what I tell all my patients, this is a marathon, not a sprint. We're in this together for the long haul, and change will happen slowly, and sometimes it happens really quick based on your kid's growth spurt, their stress level, season. I was so glad you mentioned seasons, because winter we hibernate, summer is a great time to heal. I like treating kids over summer. They're out of school, no stress, sunlight, woohoo, they're at the beach, grounding, bring them into the parks. Even if you live in New York City, go to Central Park. Keep them off pesticide sprayed lawns, please. That's not good. But you see, so there is a seasonality to treating, and I do love treating children over the summer. As soon as I see school ending up, I say, get them in. Now's the time. And I'll start going after things in the summer. So that matters. So those are the arts of the practice, by the way. And I don't want to end on a new topic, Robbie, but I just say, stay positive, network, community matters, and you will subconsciously generate that to your kids, your family, the dog. When you stay grounded, this is not a death sentence. Lyme is an infection. It's not a death sentence. And for most of our patients, they will do well. And that's our goal. And that's what we're trying to do. You cannot control this. Sometimes there are bad outcomes. Sometimes there are great outcomes. And we can't control the outcome. We just do the best we can. And we forgive ourselves. Robbie, we don't know it all. As a parent of a Lyme patient, as a practitioner, I don't know it all. I don't have all the answers. We do the best we can. And there's forgiveness of ourselves when we don't do it perfectly, because sometimes things don't work out as we planned.
Right.
And we have to find ways to deal with that as well. So
Right.
I thank you for inviting me today and sharing some of my thoughts on this, I think, life affirmative challenge.
You're amazing, Dr. Michelle. Everybody out there, if again, info.gmoscience@gmail or drmichelleperro.com. You're amazing. Can't wait to hook up with you again in the very near future, I hope. And also have you back if you've got the time and care to share more and join your community. I can't wait till you launch that new program. It's going to be amazing, like everything else that you do.
Thank you, Robbie. Anytime.
Hey, everybody, it's Robbie Bessner. Thanks so much for joining us today. Please share this content with anyone that you think might benefit from it. And we're looking forward to having you with us tomorrow for another great interview.